Last week, the Kebbi state government reported that the death toll from the meningitis outbreak rose to 56 from 653 suspected cases. Since then, the State Ministry of Health has received interventions from the federal government, including 3,000 doses of vaccines, which were allocated to the 3 most affected local government areas. As at the time of that report, just over 1,500 people had been vaccinated in Alero local government area, while 798 persons received the vaccines in Gwandu local government area and 450 in Jega local government area. The meningitis vaccination follows a 15-year cycle, with the last campaign being conducted in 2018. Let's get more updates as we are joined by the Permanent Secretary, Ministry of Health in Kebbi State, Dr. Nuhu Koko. A pleasure having you with us on the program.
Thank you so much.
Now, has Kebbi State been able to contain the outbreak in the affected areas that we just mentioned?
Yeah, so far so good. We've made a remarkable, we've seen remarkable improvement in the situation as the outbreak has been contained. The number of people reporting to health facilities with all those signs and symptoms of the disease have drastically reduced. I could say that the last press briefing we had, as you have mentioned, the suspected cases that were reported at the health facilities across those 3 local governments and some few other 2 local governments was 653 with recorded deaths of 56. The current record, as the data shows, the suspected cases is 898 with 69 deaths. But the situation, I can say, is under control. We've observed a drastic reduction in the number of people reporting to the health facilities and also in the number of admissions in the 3 isolation centers which we've set up at Gwandu, Jega, and Alero local government areas. All this has to do with the immense support we received from the state governor under the able leadership of His Excellency, Comrade Dr. Nasi Idris Gwandu, who has supported the ministry with funds for the procurement of the emergency drugs and all other necessary logistics, which enable us to procure all the necessary drugs and medical consumables, and also to embark on aggressive public sensitization, engaging community leaders to sensitize the people to know what are the signs and symptoms of this disease, and also what they should do to protect themselves from getting this disease, and also to report promptly to the nearest health facility once they observe these symptoms. So this has gone a long way in sensitizing the people and also reducing the mortalities that were earlier frightening from the beginning of the outbreak. And with this also, we received tremendous support, technical and material, from WHO, UNICEF, and also Medicines Sans Frontières. The state office also of the National Orientation Agency also collaborated with the State Ministry of Health in the public sensitization, so that people are aware of what the disease is, what they should look after, and what they should do. And if they happen to observe any sign of disease, to report immediately to the health facilities, and people are complying with this. So also the deployment of additional health personnel to the 3 most affected local governments also. This also led to improvement in the case management of those people that reported to the facilities and admitted at the isolation centers, which greatly reduced the mortalities arising from this outbreak of meningitis in the state.
Now, Dr. Koko, you've been talking about the campaigns, the deployment of personnel and what have you, but can you tell us more? How many areas has the state government been able to cover with the ongoing vaccination?
Well, as we've said earlier, we received only 3,000 doses of the meningitis vaccine, and these were deployed to these three most affected local governments of Aleru, Jega, and Gondu. And we are still awaiting more supplies from the national so that we can commence a mass vaccination, meningitis vaccination across all the 21 local government areas of the state.
Okay, so what about the affected persons? You said there are about 800 suspected cases now, over 800, right? So how is the treatment?
898 cases. Among these 898, some have been treated and discharged. These are just the reported cases, not the mortality or death. But these are the people right in the beginning. This figure is from the beginning, from the first week of the outbreak till this moment. 898 cases so far been reported. It's out of this that you have the mortalities included. Out of this figure, we have 69 deaths so far, right from the time the outbreak was declared. And out of this number also, it contains also the number of those that have been treated at the three isolation centers we set up, treated and got well and were discharged, and those that are still undergoing treatment at the isolation center that we've set up in these three local government areas, with additional one that is being set up right here in the state capital also to take care of any contingency or any unforeseen situation that may arise.
Dr. Nuhu Koko, Permanent Secretary, Ministry of Health in Kebbi State, a pleasure sharing your thoughts with us on the program.